Hi, this is Allison Villars with Health and Human Services at St. Tammany Parish Government, and I'm back with In the Loop. In the Loop is a series of meetings with people who serve our community so that you know the resources you might be able to use or recommend to your neighbors. Today I have with me Richard Craimer. Hi, Richard.
Hi.
It's good to have you here.
Good to be here.
So tell us just a little bit about you. I know you're the director of the Florida Parish's Human Service Authority right now, but what did you do before that?
So for the past, I guess, almost 20 years now, I've been in the mental health business. I started my career at New Orleans Adolescent Hospital, actually in human resources, and worked my way up through there and became eventually the CEO of New Orleans Adolescent Hospital. After Katrina, I moved over to Southeast Louisiana Hospital and was there for several years, and then was also in charge of the hospital North Lake Behavioral Health System, which took over the space after Southeast closed. So it's been about a year and a half since I moved on to Florida Parish's Human Services Authority as the executive director there, where we provide behavioral health services and developmental disability services. So still kind of in my wheelhouse with the type of work I've been doing my whole career.
So how did you know you wanted to work with mental health?
Some of it was a happy accident. My undergraduate actually is in psychology. I had different plans for how my career might work out, and it just turned out that I wound up working in human resources in a mental hospital. Once I got into that business, I had kind of a calling to it. I saw it was a population that was underserved. There's lots of work to be done that could make a difference, and I was lucky enough to work with some people who could mentor me and help me grow my career. Mm-hmm. And I think I've been able to gradually move up and take on more responsibilities and affect the community in different ways in that field.
So what's your undergraduate degree in?
The undergraduate's in psychology from UNO,
right.
And I've got a master's degree in business administration focusing on healthcare management, also from UNO.
Okay. So how do you like it on the North Shore?
I love it here. I've got a wife and two kids that we've been here for, I guess, almost 18 years now, or 13 years now. And it's really a great place to raise a family, and we're really happy with everything it has to offer.
Mm-hmm. I'm real interested in the work you do, not just because I work with the Parish Health and Human Services Authority, but because in my family we have a big issue with bipolar. Mm-hmm. And I have a niece who is on disability and lives in Philadelphia, and a sister who's bipolar. So I'm glad that you're doing the work that you're doing, and happy to learn from you every day when we are in meetings together.
Which is often.
Which is often, about what's going on. So tell us, where is Florida Parish's Human Services Authority located, your main office, and then where are your satellite offices?
So our main office is in Hammond. That's where our executive administration is, as well as our developmental disabilities headquarters. We also do have a Hammond clinic at that same location. We serve all 5 of the Florida parishes. Of course, St. Tammany is one of those. In St. Tammany Parish, we have 2 clinics, one in Mandeville on Florida and one in Slidell on Kerry. And we also operate an inpatient substance use residential program in Mandeville as well, on the old Southeast campus site where Safe Haven will be.
Okay, so in the clinics that you have in Mandeville and Slidell, what services do you offer?
So those clinics both are behavioral health clinics, so they provide mental health services and substance use services. That can include anything from medication management with psychiatrists or nurse practitioners or medical psychologists, individual therapy or group therapy with clinicians, social workers and counselors, as well as intensive outpatient services. One of the things we've recently added to our services is medically assisted treatment for substance use, which is a really critical component of our treatment these days with the opioid epidemic.
Mm-hmm. Well, there's so many questions I have about all of what you just said that I'm going to start with the last one first. So let's talk about opiates. If somebody called and said, I think I have an opioid problem, I'm taking 7 Percocets a day, what would you recommend for them?
Well, the first step they should do is come get assessed. It all starts with an assessment, no matter what the problem is, whether it's behavioral health, mental health problem or a substance use problem. It starts with an assessment to see exactly what problems you have, what's the right treatment for that. So in either of the clinics I mentioned, Mandeville or Slidell, anybody who thinks they could benefit from our services You can walk in there anytime during business hours. Generally, best times to come would be between 8 and 3. We're open from 8 to 4:30, but if you come a little earlier, it'll give you time to get through the process. You'll get assessed by a therapist there to kind of, they'll put you through some standardized questionnaires and ask you some certain questions to see what it is you're facing, what you feel like the challenges you have are, and through that process, there's some standardized scoring and best practices that we'll look at to see what it is that is probably best for you in the particular spot that you're currently at. A lot of those services we'll be able to offer ourselves in our clinic, and we'll set you up for that if you're interested. Otherwise, there might be some that we refer out to other providers that provide services that we don't have. But again, the first step is to make sure if you feel like you have a problem and need help, get into the clinic and get assessed so you can find out how, what that problem is and what can be done about it.
And so how do people pay for services like this?
Because we are a public safety net provider, nobody is turned away for inability to pay. If you have coverage, if you have Medicaid, or if you have private insurance, we accept all of those types of payment. Mm-hmm. If you don't have any type of way to pay or any coverage, we'll work with you on that too. Inability to pay should not stop anybody from getting services. If you think you need it, don't let that stop you from coming in.
You said one other thing in the intro about all the services you offer at the clinics that was really interesting to me, and it was medically assisted
treatment.
Treatment, okay. So can you talk about that?
There's several different things that fall under that label. Some people are probably more familiar with things like methadone or Suboxone, which are two types of medications that are used to treat people with opioid dependence. What we use in our medically assisted treatment currently is something called Vivitrol. Mm-hmm. What that drug does is it actually blocks opiates from having any impact or any effect on someone who takes them. So it's a monthly shot that someone who needs it comes in and gets. And while that medication's in their system, there's no impact of taking an opioid. So, that will help people who are dependent get off of that. And none of those medications are standalone treatments. That's a component of treatment, along with counseling and groups and other things that will help get someone into recovery.
Now, there's a lot of questions about medically assisted treatment in some places around the mm-hmm. country. Have you had any resistance to it here?
Not so much. There are differing opinions. Most of those opinions where it is split is more on the methadone or Suboxone than Vivitrol, just because the way those drugs work are a little different. Mm-hmm. My personal opinion is the opioid epidemic is as bad as it is. I think all options need to be on the table for the people that need those particular options. No particular type of treatment is the right treatment for everybody, but every type of treatment is probably the right treatment for somebody.
Mm-hmm. So, I think one of the things that will bring people into clinics or seeking assistance is hearing from people like you who really have a calling for this. Can you talk about any of the clinicians? You don't have to name them by name, but some of their backgrounds and some of their interest in helping people and stories that about what they do to go out of their way?
Well, I think we've got, we're really blessed in our clinics to have a great group of clinicians. We are kind of a public agency that doesn't have the luxury of always paying people what they're worth. So a lot of people who work for us are there because they care and because they have a calling to help this population. No one's there because it's the career that's going to get them rich. Mm-hmm. So we've got lots of different people with different backgrounds, some people who may be in recovery themselves, who can offer a different perspective and help people along in their journey to recovery. And I think we've got, like I said, staff who are really dedicated to this cause, trying to be really dynamic and looking at different ways to address the problems that face our community. Mental health and substance use are notoriously underfunded, not just here, but across the board in the country. So we have to be creative in how we use the limited resources we have to help the most people. And I think we've got a team that are perfectly suited for that.
So you mentioned at the main office you have a disabilities clinic or center. Can you tell us about that? And are there services in other of your clinics for people in that population?
Yeah, so one of the things that the districts and authorities do across the state we're the local agencies that handle developmental disabilities issues, helping people in the community that need those type of services, connect with services. They might be waivers or other types of funding to help them with their needs. What we do is we serve as the single point of entry for those types of services. So if someone has a family member or themselves who they think might qualify or need those services, they can come in. Again, they'll get some type of evaluation that they'll go through to determine if they qualify and what they qualify for, what level of need they have, and what services might best help them. So they'll get into the system that way. Depending on which service they have, some of them get offered directly through our agency. Some of them are Medicaid waiver services that we kind of facilitate, but we don't actually provide those services. But the first step is making contact with our developmental disability staff, and they are all housed at Hammond, at the Hammond location. But make contact, and we can meet people in the community or at the clinics if there's a hindrance to them getting to our Hammond site to get them the paperwork and get their evaluations, get them started in the system.
Well, you said there are multiple kinds of ways you could assist them. Can you name a couple of them just so people out in our public will understand what you have?
Sure. The waiver services are the big thing. Most people in the developmental disabilities community are aware of that. That's some of the waivers are the big ticket ways that really can provide some supports for those who qualify. And obviously there's a much greater need across the state in our area than can actually access those. But that's kind of the Cadillac of what's available. It's the top notch of what we can offer. But for those who either don't qualify for that or who aren't able to get to it yet because, just because of limited resources, there are other things that are offered, such as individual support funds and family support funds that get approved by a committee. If there's a request for some type of service that's needed, whether it be respite services or a home modification for somebody who may be newly in a wheelchair and have difficulty getting around, those are the types of things that can be requested, and the committee will weigh all the requests, see which ones, based on the resources, can be funded. And we do our best to fund as much as possible and help the most people we can.
Okay. And so if you were going to sort of total up the number of people you help a year, about how many people are y'all in contact with?
Number of people is probably in the area of 15,000, 16,000 based on the last annual report I looked at recently. Mm-hmm. It's kind of a fluid number. It's not the same every year. And some of those people we might only see once a year. Some of those people we may be seeing several times a week for most of the year. It all depends on what services they're getting. But we do see quite a lot of people, and I think we make quite a bit of difference in their lives.
Okay. So you and I we meet a lot on a bunch of different committees, and I know right now you're serving on a very significant group of committees, actually, for a project that President Brister has really helped move forward and the parish has been behind, and that is the conversion of the Southeast Louisiana Hospital to a site that would be very accepting and respectful of people who have mental health and substance abuse issues or behavioral issues, and that there's this place called Safe Haven coming online. So will you talk a little bit about that? And just so I can be clear with this, we're not going to get everything in this particular shot, so we may get Richard back later to talk about it some more. So tell us about Safe Haven, which is the name of the project.
So like you said, that it's kind of an initiative by President Brister to take what used to be part of Southeast Hospital's campus and make it a mental health or behavioral health center where people in mental health crisis can go and get the right services they need in their crisis, but also to connect them with what they'll need next. As it stands currently, and this is not a St. Tammany issue, it's a everywhere in the world issue, people in mental health or behavioral health crisis are ending up in our jails and ending up in our ERs. Those aren't the best places for them to get the services they need, and it's not the best place for us to use our resources because those are both costing a lot more money than needs to be spent for them to provide them the wrong services that they don't really even need. So Safe Haven, the idea of Safe Haven will allow them to get to the place they need, to get the right services, connected with the right services to follow up, and also stop taxing the other services, such as the ERs and the jails, with things they don't need to be serving so that they can put their resources where they need to be. So it should make the whole continuum of services for everybody, not just the people that use Safe Haven, but even the people who use the other services. It should make the whole system work better.
So let me give you a for instance, because I know these kinds of issues have been talked about in all the committees that you're on. And one is that someone in the population calls 911 and says there's a guy in the middle of the street, and he's yelling and screaming, and he's taking off his clothes or whatever. And they call the police. So what is your idea from a mental health perspective or substance abuse perspective? What should happen in that situation? Or what ideally in relation to Safe Haven have we talked about happening?
Yeah, there'll be kind of an algorithm of things that happen. Some people will still need to go to the ER because they may have some situation that requires that level of care. And some people may still need to go to jail because they may have done something that requires them to go to jail. But there's a certain population of people, and it's quite a few of them, that really just need to be stabilized from whatever mental health or substance use situation that they're in. And the jail or the ER aren't the places for that. So this hypothetical guy that's in the street screaming, he may be somebody that's well known to the police. Maybe they've responded to him before. Maybe he's got a well-known condition, and maybe he's off his medication, or maybe something else happened that exacerbated his symptoms today, and that's why he's out in the street yelling. So let's say in this instance he's not done anything criminal and is not a immediate threat to somebody. But clearly it's not healthy for him or the community for him to be in the middle of the street screaming and naked. That's where a Safe Haven would come in. The police they responded to the situation, make sure everything's safe, nobody's in danger. They could transport this gentleman to Safe Haven where he'd be assessed. They determine, what's going on with him. If it's somebody they know, then obviously they've got the benefit of that to kind of look at what happens with him generally. But if it's not, they can do an assessment, determine what's going on. Does he need a couple of days stay there in what'll be the crisis unit to help get him on the right medications and help get him with the right services? Or is he somebody that just needs a couple of hours with the right support to get him through whatever he's going through at this minute, and then he can, be discharged back home or allowed back home and with a plan to follow up with whatever other services are appropriate for him.
Okay. Richard, I'm going to take a break here and ask you to hang in there with me, because Safe Haven is a really important project and Richard knows a lot about it. And I'd like for you to hear his role in the ongoing project in the next small portion of In the Loop.
They told me a bottle couldn't dream, that I would never become a superhero. But I learned how to fly, just to come back in a new disguise and be the hero that I've always wanted to be.
Hi, this is Allison with Health and Human Services in St. Tammany Parish Government, back with In the Loop, and Richard Craimer, who has graciously agreed to stay with us to continue our discussion about Safe Haven, which is a wonderful use for behavioral health issues in our parish. It is located on the former Southeast Louisiana Hospital campus, or will be there, and Richard's been a key person in helping make this happen and has the expertise to tell us what's going to be there. So Richard, we were talking in the prior session about Safe Haven and exactly what it is, and you talked a little bit about respite, for people to sort of get back together on the right medications, and that some people would be there, be assessed, and have some help some semblance of assistance at that point, and then go off into their lives. So what other kinds of people are going to show up at Safe Haven, and how would they get there?
I think the vision is for Safe Haven to have all different types of human services type components there. It's obviously got to start somewhere, and hopefully the other services will grow around it as it expands. The first pieces that are being considered have kind of a triage unit where people either brought in by EMS or by the police or family members or however they got there would be assessed to see what they need to. Maybe that's somebody that does need to go to the ER, they can be forwarded there. Maybe it's somebody that just needs to be set up with services. But they'll be able to triage them and assess what it is they need in their current state. Attached to that will also be a program, a crisis receiving center, which is kind of the model that it's being based around, which would allow people who do need, they don't quite need hospitalization in an inpatient unit, but probably need to stay somewhere where they have some kind of monitoring and supervision and support. So that would be just up to a 72-hour max length of stay for people in that type of program. And then one of the other components that's initially being considered is a sobering unit, which is pretty much what it sounds like, somebody who's kind of getting into things they don't need to be getting into because they're currently under the influence of something. It's a place that they could be brought, have supervision to make sure that they're safe in a monitored environment while they sober up. So a big component of that is keeping them safe while they're under the influence of whatever it is they're using. But the other part of that is while they're there is trying to engage them in treatment so that they're not in the same situation tomorrow. Mm-hmm. Typically a person that's going to need a sobering unit is not a person who had a couple of drinks or something one time. It's somebody that's probably got a problem that needs to be addressed. So keeping them safe is only the first part, and engaging them in treatment is really the more important part moving forward.
So how will Safe Haven, that group, address all of the other entities on the campus? Because there are lots of other providers there in part. So could you tell us a little bit about them and what that relationship might look like?
Yeah, what else is there right now are kind of complementary services. Mm-hmm. Obviously it was the Southeast Hospital campus, so it's a campus known for mental health services. North Lake Behavioral Health System took over the acute services and some other psychiatric services following the closure of Southeast. They're still there operating many beds.
Not everybody out there is going to understand acute services. Could you tell us what that means?
Sure. So people that know Southeast from the old days might think of a state hospital or mental hospital like it used to be back in the old days, which was somebody would go away to a hospital and sometimes stay months, years, and some people would just feel like they go there to live there because they can't live in the community. That's kind of an outdated way of thinking about mental health treatment. There are some people that probably need that level of support, but it's not nearly the number that used to be in those type of institutions in the past. Mm-hmm. So acute services is more the type of service that someone, typically to go into acute services, somebody needs to be either a danger to themselves, danger to others, or gravely disabled. A lot of times, some of the most frequent diagnoses you'll see there are bipolar and schizophrenia, and a lot of those people may be coming in with suicidal thoughts or thoughts to hurt someone else. So they come in, generally acute stays are less than 14 days, sometimes much less, sometimes only a couple of days. And people that come in for those acute stays will generally get stabilized on some type of medication and set up with a discharge plan for outpatient treatment to get counseling and make sure that their medication is right as they continue in their path to wellness.
You've talked periodically about the use of medication in treatment, and that the doctors would make sure that they're on the right dose and that kind of thing. Can you talk to us about what the role of medication, I mean, I'm sort of off of Safe Haven, but not really, because people I think would be interested in this. What is the use of medication in treatment, not about opioids, but about people in mental health issues?
So I'll preface this by saying I'm not a physician,
Right.
but I am in the mental health field, so I've got my opinions on it. There may be other opinions, but I think due to mental health stigma and just misunderstanding about mental health, many people have what I consider to be inaccurate opinions about medication for people with mental illness. No one questions whether if someone has diabetes or high blood pressure or many other types of physical health conditions that medication is necessary to handle those challenges. Many mental health issues are biological in nature and are no different. No amount of walking in the park or good conversations or happy thoughts can help overcome biological problems that need to be addressed with medication. Those things are all part of a good plan, but some conditions are not going to get better unless they have the medication that helps treat that biological issue. So it's a critical component, and medication has come a long way. You know, medications of the past were not didn't have the greatest results or had side effects that were not that might have been worse than what they were helping. But medication's come a long way, and it's continuing to improve. But I think every person needs to make their own decision what's the best treatment for them along with their provider. There are different choices for medication. There may be one that gets recommended to you that you think is not good for you for whatever reason. That's something I would encourage anybody to talk to their provider about. Make sure that you pick whatever the right treatment plan is for you, because everybody's a little different.
Okay, well, I appreciate that, and I know it's a little bit of a side, but it is what is happening in the field today, and I think it's important for people to understand that. And many family members of people with behavioral health issues, mental health issues, might be asking that kind of question. So the other people, besides North Lake Behavioral Health Hospital is out there, you have a 28-day program.
We have our residential program out there, which is akin to a 28-day program. Under managed care, 28 days is not the usual anymore, but that's still kind of referred to as that. Methodist Children's Home has a PRTF out there. And
PRTF?
PRTF, I'm sorry, Psychiatric Residential Treatment Facility, which is a longer-term program for adolescents with behavioral health needs. St. Tammany Parish has an alternative school there, and NAMI runs group homes for individuals with severe and persistent mental illness on the same campus. So there's plenty of similar services that serve the same population, and I think Safe Haven on that campus helps kind of, you know, capitalize on that synergy and pooling resources and using the expertise of everybody together to try and make a difference in this issue.
So when do you think Safe Haven will open?
Not soon enough. I know that there's lots of work going on many fronts to try and get there. I know that there's a desire to get it open as soon as possible, shared by many, but I don't know what. I don't know that I'm the one to give the projected date. I'll leave that for others.
I know you're working with the team to help put together the plan of what services will be there and how they'll be offered and who will offer them and that kind of thing. And we appreciate your service on that group. Can you tell us just name the other committees that are working? I know there's an executive committee and you're on it.
There's an executive committee. There's a jail diversion committee. Since one of the big focuses is to try and keep people that don't need to be in jail out of jail and get them to mental health services as well. There's a healthcare committee, which is focused on what types of services are going to be provided there. There's an education committee, which, as the name suggests, is looking at what types of education around Safe Haven and around mental health can support this program.
Right, and the education committee actually worked out to have some sheriff's officers trained, is that correct? In what?
That is correct. There have been some officers trained in crisis intervention training, which in our parish, Sheriff Smith has started a team that's out in the field responding as to mental health calls, and there are some officers that are specially trained with the skills to intervene in these type of situations. So I think that's a really good addition. It's, you know, it's best practice that's happened across the country and some other places. It's a really good addition. It's something that we're going to try and encourage to spread some more of. At Florida Parishes, we're actually working on trying to get some training to the other sheriff's offices in our district, to have that expand, and hopefully the start of the program here in St. Tammany will grow and be successful as well.
Well, we really appreciate you coming and visiting Within the Loop and taking all of your time away from the people that you really serve in the community, and we're very appreciative of your call to participate in this vocation. And we send a thank you to all of your staff throughout the Florida parishes on behalf of all of us here in St. Tammany for really stepping up and helping our neighbors.
Happy to be here, will do.
Okay, thanks a lot. Thank you for visiting Within the Loop again today. And our star today has been Richard Craimer, who is the Executive Director, CEO?
Executive Director.
Executive Director of Florida Parishes Human Services Authority, with their main offices in Hammond, Louisiana, and 2 clinics here in St. Tammany Parish, one in Mandeville and one in Slidell. Thanks again.